Recording in progress. Good morning, everyone. Happy Monday. Welcome back to Public Health. We're glad to see everyone here and that everyone made it at the right time with the daylight savings time change. With a shout out to Representative Vail for that. We're all feeling the pain of the adjustment this week. So we are going to have some fun voting on some bills and discussing some very important concepts today. And with that, I'm going to turn it over to my good co-chair, Senator Elmore.
Thank you, Madam Co-Chair. Let's begin.
Representative Clara DeStitria.
Thank you, Madam Co-Chair. Good morning, everybody. We're ready to go.
Thank you. Senator Summers, good morning.
Good morning, everyone. Looking forward to getting through this agenda. I know we're going to have a really busy week, so thankful everybody's here.
Thank you so much. Well, with that, we are going to move on to agenda item number 3. Before we do, I'm going to ask that everyone is very cognizant of speaking directly into their microphones today. We know that we have had some technical issues in this room with sound this year, and I believe that there are some issues in terms of volume. So if you are speaking today, please speak directly into the microphone and use perhaps your outside voice or slightly outside voice. So we'll move on to bills to be considered for JF action. First, we have item number 1, Senate Bill number 364. This is an act concerning extreme weather protocols. This is a JF to the floor. May I have a motion?
So moved.
Moved by Senator Onwer. Is there a second? Seconded by Representative Biggins. The Extreme Weather Protocols Bill essentially requires that standardized hot and cold weather protocols be promulgated by the Division of Emergency Management and Homeland Security. It also assures that there's ways for people to access transportation, that the protocols are posted and given to 211. I will acknowledge that some of these things are happening. Part of the impetus of this bill is to further refine, codify the protocols and refine the process so that we assure that those who are outside in these extreme heat conditions are able to be housed safely. And is there discussion on this item? Representative Clara DeStitria.
Thank you, Madam Chair. Just a few questions and concerns. Would these protocols require municipalities, towns and cities to open their cooling and heating centers, or is it just a recommendation?
Thank you for the question. I think at this point, the protocols as they go into place, this bill would have to actually address and discuss whether that would be a recommendation or a requirement. The current cold weather protocols and hot weather protocols, I believe, do require that those heating and cooling centers be made available and also publicized. But I think part of the point of the discussion of this bill in particular is to determine what actual steps should be standardized and put in place, and also to address the particular temperatures. I think that's been part of the conversation that we've seen. At this point, it's single-digit temperatures when it comes to cold weather. And though we have seen this year that those protocols have been activated at higher temperatures, the idea is to have some more standardization in that regard.
Thank you. And who does it say will determine what the protocols, what the heat index temperature, who will make those decisions?
Thank you, Representative. This would be within DESPE, the Division of Emergency Management and Homeland Security. And they work together with a number of different agencies, including DSS and DEMIS. They work with United Way, with the Interagency Council on Homelessness. There are a number of different stakeholders involved in the conversation. I will also add, we intend to meet later this week as leadership. As you know, the bipartisan leadership of this committee will be meeting with those stakeholders to continue this discussion. So we expect that there will be further changes to the language of the bill.
Okay, thank you, Madam Chair.
Thank you, Representative. Representative Reddington Hughes, to be followed by Representative Mara.
Thank you. My question has to do with I'm a little unclear as to whether or not this is saying that the heating and cooling centers that are already existent, okay, are going to be under these under these new regulations to do this, or if this is saying that every single town across the state of Connecticut needs to have a heating and cooling center that they are going to have to fund.
Thank you for the question. So as I mentioned in the introductory remarks, there are protocols that do currently exist. And the idea with this conversation is to further refine that and standardize. There are many communities that will not be able to operate a heating or cooling center. Cooling centers are often things like, for example, our public libraries. So those are in most of our communities, and they get designated and communicated. So much of this process is about how the communication occurs. So that is something that would be explored as part of this ongoing conversation. But again, there are current protocols in place, and not every single community is currently opening up.
I'm just unclear as to whether or not this would require the towns, like when somebody calls 211, would it require your town to provide transportation for the people in that town to the cooling center in wherever it would be?
So the current language of the bill does not do that. It really asks that those protocols be developed, and what those protocols would say that would be any different than what we would have, what we have currently would be determined. And again, that would be done, through DEMIS, as opposed to DEMIS, which is our group, but DEMIS under DESPE.
So then we're just unclear as to what would really happen.
That's right. I think part of this is about potentially codifying what those protocols would be. But again, there are posted protocols that are online. What changes might go further, we don't know for certain at this point.
Okay.
But the language of the bill does not contemplate that at this point in time.
Thank you.
Representative Mara.
Thank you so much, Madam Chair, and Representative Reddington Hughes asked most of my questions. I just want to reiterate that I do, and I talked about this in the public hearing, I do support better organization around this process, and we've seen where there are many cracks in the process. However, so I will be supporting it out of committee today, with hopes that it doesn't end up being an unfunded mandate on our towns and municipalities. Thank you.
Thank you for that, Representative Mara. Are there further comments or questions? Representative Dauphiné.
Thank you, Madam Chair. I too, I think that the intent is good. I am concerned about what kind of mandates might come out of this. It sounds like it hasn't all been decided yet. So I will be a no for today. Thank you.
Thank you very much, Representative. With that, we are going to have to recess for a moment because, surprise, technical issues. So if you could just hang on. And I really appreciate this committee's patience and the public's patience with us. So we are in recess for just a moment.
Just check 1, 2.
Welcome back, everyone. Thanks again for your patience. So we were on item number 1, Senate Bill number 364, an act concerning extreme weather protocols. Is there additional discussion on the item? Seeing and hearing no additional discussion, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Representative Belton,
Belton votes yes.
Senator Marks, Senator McCrory, Senator Summers,
Summers votes no.
Representative Clarice Detrier,
Clarice Detrier votes no.
Representative Burgess Givallo, Representative Biggins,
Biggins votes yes.
Representative Carpino,
Carpino votes no.
Representative Dauphiné,
Dauphiné votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes no.
Senator Harkadel, Representative Cavers DeGraw, Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy, Senator Kushner, Representative Morrow,
Mara votes yes.
Representative Martinez, Representative Maureen Bello,
Representative Morin Bello votes yes.
Representative Parker, Representative Paletto,
Paletta votes no.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Romano, Senator Slapp,
Senator Slapp votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis,
No.
Thank you, Madam Chair.
Thank you very much, Madam Administrator. Moving on to item number 2, this is Senate Bill number 365. This is an act establishing a bridge program for emergency treatment and recovery navigation for persons with an opioid use disorder. This is a JFS to the floor, LCO 2925. May I have a motion?
So moved.
Moved by Senator Anwar and seconded by Representative Kitt. This bill will require our hospitals to administer buprenorphine or methadone to patients in emergency departments, and it will not require the patient to be admitted in order to receive this care. This will be only if it's medically indicated, if there is patient consent, and if there is an administration of buprenorphine, it will require a bridge prescription for the medication. If there is methadone, it will require a last dose letter to be given to the referred program or provider. It also adds the offering of prescription for Narcan and a referral to a community provider or DEMIS. The changes in the S language are the addition of methadone as a treatment option, not just buprenorphine. It also requires the prescription and last dose letter that I just referenced, and it creates an exception for the professional judgment. It makes sure that we're allowing for the clinicians to use, of course, their best practices, And that adds the addition, it adds the community providers. That is an addition in the language. Is there discussion on the item? Representative Clara DeStitria.
Thank you, Madam Chair. How will these services be billed in the emergency department? Because I know it won't be, if it's not an actual emergency, it'll be a, whatever they call it, non-emergent service. And who will this be covered under insurance, or is the hospital going to be responsible for footing the bill?
Thank you for the question, Representative Clara DeStitria. And although I'm not a lawyer, I'm going to give the "it depends" answer. And I don't know that I have all the specifics. I recognize that this is a concern that has been raised by the Hospital Association in terms of payment. So I think that's something we're going to have some further conversation about, and I think it will depend on the circumstances of the particular patient who is being seen in the ED.
Okay, I think this is something, this really needs to be figured out before I believe that this bill can move forward. But my next question, I guess my concern is that our hospitals are going to become clinics. If I go into the ED and I end up getting treatment from the ED and it's non-emergent, and then the hospital is required to make a referral for me. So it's just the referral, it's not actually securing an appointment. Is that correct?
Thank you for the question. I do believe this is a referral. I think the intent behind this is obviously first and foremost to make sure that we're saving as many lives as possible, helping people remain on a path to treatment and recovery, but also in the hopes that we are saving costs. So the referral is not necessarily specifically an appointment. It's not specified that clearly in the bill.
Okay, and that brings up my other concern. So if it's a referral and I'm given one of the two meds, who's to stop me from not actually making an appointment anywhere and just coming back to the hospital in a week or two or whatever the time frame is to then get another? That will basically be my clinic appointment again at the hospital. And I don't see anything in the bill that's prohibiting patients from doing that.
Thank you for the question. I appreciate that. I think that it's important to see this bill in the context of services. I'm grateful that we have, recovery support and peer support that's available in many of our EDs as well. And though I can't speak for a hospital, I imagine that we would have folks, social workers and other recovery support and peer support who would help to address that. There's nothing specific in the language of the bill that actually would preclude that. But again, the idea is to refer to services, and I am making assumptions on that, but believe that if they were to see that kind of repeated entry, that there would be additional work to try and help get them in the right direction. Again, this is a program that has been shown to be effective in some other places in the country. So goal is to get people on the right path, but again, does not specifically address that in the bill.
Okay, I appreciate the fact that we all want to save lives, but the goal is to get someone into recovery, and I don't want especially our emergency departments, to be one, footing the bill, and two, becoming a clinic. I will be a no today. I appreciate the intent of the bill, but I just don't think you're accomplishing what the goal was here today. Thank you, Madam Chair.
Thank you, Representative. Senator Gordon, to be followed by, actually Senator Summers, I'm sorry, to be followed by Senator Gordon and then Representative Zupkis. Senator Summers.
Yes, thank you, Madam Chair. I just wanted to align myself with the comments of the other good ranking from the House. I understand the intent of this bill. I do not think this bill is fleshed out or has the correct language to really have it come out of committee today. I know I don't like bills that are works in progress. I do think that this is well intended, but it's going to put this unfair mandate and burden on our emergency rooms without sort of justification or how they're going to be compensated. I think it's going to become a dumping ground for people to continue to go to. There's no appointment. It's just a referral. We could do that now. So for these reasons, I'm going to be a no today. Thank you, Madam Chair.
Thank you, Senator Summers. Senator Gordon to be followed by Rep. Zupkis.
Madam Chair, thank you. And I appreciate the concerns that have been raised by my colleagues. I understand the intent, and I can certainly understand it with regards to trying to help people and save lives. But we also have to look at this from an operational point of view. And one question I do have is there going to be an effort to take into account and potentially work on this bill, but take into account, I thought, the very wise recommendations submitted by the Connecticut Hospital Association to get away from making this more of a mandate, especially unfunded mandate, especially posing more potential liability to emergency room doctors and other healthcare professionals deciding or not deciding in clinical judgment when and when not to use these medications. I don't know if that's going to be taken into account, because I thought their written testimony was spot on about how to make this bill operationally better in the real world of care in emergency departments, when we know that emergency departments are already overcrowded as is.
Thank you for the question, Senator Gordon. And yes, I anticipate that we will be having conversations with the Hospital Association, ED docs, and other stakeholders to make sure that we are able to implement this in a way that works for and that is effective at helping to address the need in the way we had intended.
Well, thank you, and I appreciate that. And I just want to highlight a couple other things that I think was really spot on by the written testimony from Connecticut Hospital Association. One is, if they were to give this out free, so to speak, then that goes through their own supply they use for their own patients, many of whom get discharged from being in hospital for various reasons, or even in an outpatient setting that might use their pharmacy services. So I think their recommendation is about whatever the supply might be that the state might be able to get for them, for example, through DEMAS. I think that's a very good recommendation on their part. And the other is, I don't think we should at all be putting the word shall or must in. Leave it for clinical judgment to be decided, because if someone were to say they didn't feel it was clinically, in their medical judgment, appropriate to give, let's say, methadone, but this were to pass with the wording that says shall be given, that even though there is some clarification in here, I think it puts too much liability on them. Again, CHA has some good proposed wording that I think fits for the reality of medical care in emergency departments. And I'm going to be a no on this based upon the wording as is, and to flag it that this clearly does need work, and I would champion the CHA's wording. I think that would make the bill better and more workable. Thank you.
Thank you, Senator Gordon. And clearly with the change in the language in the S language, we agree that we need to be sure that that clinical judgment is primary. Representative Zupkis.
Thank you, Madam Chair. And Senator Gordon just really talked about what I wanted to just comment on about the overflow. Our ERs are, we've had a bill talking about how can we relieve some of the congestion, overflow, wait time, all of those things in our ER. And I am, as our good ranking member spoke about, concerned about people just coming there kind of as frequent flyers, so to speak. And so that's really a concern. Do you have any idea what would be the cost?
I do not have an answer to that at this point.
Okay, and we are going to be, or I should say y'all are going to be working on this more to try to make it a little more conformative to CHA's request.
We are going to enter into conversations as we always do. After the JF meetings, we spend a lot of time with our friends from the Hospital Association, who I see here in the room, and discuss all the relevant bills. So we need to make sure that it's operational. And I think in terms of funding, I think there are a lot of ways to take a look at that. We have the Opioid Settlement Advisory Committee, which is something that has done a lot to fund prevention, treatment, intervention for those who are suffering from opioid use disorder. So there are a number of different ways to get at this, but we will certainly be in conversation with the CHA.
Great, thank you so much.
Thank you. Representative Clara DeStetra, then Senator Anwar.
Thank you for the second time, Madam Chair. I wanted to reiterate what some of my colleagues mentioned. We already passed a bill studying emergency department overcrowding. I'm just concerned about adding something else that could add to the overcrowding without figuring out what we passed, years ago. So hopefully that will be addressed as well. Thank you, Madam Chair.
Thank you very much. That's certainly an ongoing conversation, and we want to thank all those who continue to do that work. Senator Anwar.
Thank you so much, Madam Co-Chair. So, Madam Co-Chair, it's worthy to have a little bit of stepping back and looking at the bigger picture of what's going on. This bill is not asking people to come to the emergency room. The people are coming to the emergency room. If a person comes to the emergency room and the clinician assesses them and identifies that they are using substances and they are in need for detox or they need to be provided care, historically what would happen is that those individuals would be assessed. If they are in urgent need of care, they would receive the care. But those facilities at times have not been able to send them for rehab facility and also give them their first dose or give them the prescription for the dose of proven treatment. This is what would be common sense approach. And thankfully, some of the hospitals are doing common sense approach without this bill, except the challenge is that not everybody is doing that. What we do want, and I know around this circle, everybody has spoken about, we want rehab, and even if you die before you get rehab, it's okay as long as you get rehab. And we've heard this conversation. But I want you to know this is part of the rehab access point. This is where the rehab starts because you need the first treatment and you get started on the treatment and then you can get a prescription. So we are not asking them to keep the medicines in the emergency room. If they don't have it, they write a prescription. And then connect them with a rehab facility, and that's the path for the rehab. So that's where it is proven. Other states have done this. In the Connecticut, many hospitals are doing it. Not all hospitals are doing it. Demas has been involved in helping the hospitals, and they have had very good results of this. So what we are doing is we actually also, the American Society of Addiction Medicine, this is their #1 priority. These are the clinicians who have dedicated to do addiction medicine and taking care of the patients in our state. They have asked that this bill should pass because they feel this is a very critical bill for helping the individuals get through rehab. The status quo is not working for all. That's an unfortunate reality, and we have a responsibility to address them. With respect to the Connecticut Hospital Association, the language becomes permissive, but the thought process of consideration is not permissive. In other words, a clinician can see that patient and they have to address that this issue needs to be addressed. But if it's not clinically indicated, they're not required to do so. So legal protection is there in the bill based on that language, and our lawyers have confirmed that with respect to that part. So we have actually been able to accommodate the various individuals who came out to speak, and we are truly appreciative of them coming out to speak because this JFS language accommodates all aspects of this. So, Madam Chair, I wanted to just clarify some of these aspects. Thank you for your indulgence.
Thank you very much for that, Senator Anwar. And I think it is an important point to point out that there are hospitals that are already using this here in Connecticut. So I see a number of hands. I'll go Rep. Carpino, Rep. Mara, and then back to you, Rep. Clara DeStetria.
Thank you, Madam Chair. Perhaps I misheard the previous speaker, but I thought I heard that people in this committee keep saying we want rehab, even if they die first. And if that was accurate, and I hope it was not, I find that conduct unbecoming a member and is so disrespectful to this process. I hope I did not hear that, because I can't imagine a member would actually say that during a committee discussion. But if so, I'm offended. And it takes a lot to offend me. We enter into these conversations because we want to serve the people, and at least I want to hear the different viewpoints. We all want to do right by the people we serve, but sometimes we disagree about the right way to get there. So I do just want to say that I found that offensive to the process and to members who may not be able to support this, because we care about our emergency rooms and we care about people getting the right treatment when they need it. But ma'am, that is not how we conduct business in this committee.
Thank you, Rep. Carpino, and I'll just step back from the stepping back. We have had many discussions around this circle related to the issue of addiction and death and suffering and illness. And we have heard much testimony, heartfelt testimony from people who have suffered a tremendous amount of pain. And I recognize that as we address these issues, like we will later this week, there are many issues that we address that engender a lot of emotion. So I do appreciate the emotion on all sides of this and recognize that we want to stick with the facts of the bill and the reasons behind the bill. And I appreciate that it can be a problem when we assume intent of others, and I understand that. I think I would like for us to return to a discussion, if we can, on the topic of the bill, on the substance of the bill, on the concerns, as you, Representative, indicated, that have been addressed by those who testified and those of us here in the circle. And I appreciate your comments and hope that we can continue forward in a way that allows us to focus on that substance. Representative Zupkis, to be followed by Representative Clara DeStitria. Oh, I'm sorry, Representative Mara. I lost track.
That's okay. Thank you, Madam Chair. I will second Rep. Carpino's comments, but in efforts to move things forward, I will. And I think that I appreciate addiction medicine's stance on this, and this is their ask, but they should not be taking over what happens in the emergency department. And we need to get the emergency department doctors on board as well. And the way I see this now, they're not. But if you're going to successfully move a program forward and you're going to then put this under, the scope of what the emergency department doctors are doing, which, by the way, they are required to save lives for people that come in. There's no nefarious practice that the emergency department or doctors are having here. They are moving these patients forward. I appreciate that we are wanting to have referral for people that come into the emergency department. And I stand strong with finding a better way to organize that and move that forward. But putting extra duties on the emergency department, this is not the process to do it. We're shoving it down their throats instead of, clearly you say that there are hospitals that are doing this. We need to find out how they're doing it, what their processes are, and talk to the other hospitals and see if they can implement them. But having this be a mandate and forced on, I think, is probably not the way to move forward with a successful program. I'm going to be a no today, but I think, as we all know, I stand strong for trying to find ways to deal with people that have opioid use disorders, and I too would like to save their lives and help them on a road to being better people while they're addicted, as well as eventually finding rehabilitation. Thank you.
Thank you, Rep. Mara. And just to confirm, we have ongoing conversations, and certainly will be, with our ED docs and the Hospital Association as well. And oftentimes, though we don't all like it, sometimes even as leaders in a bipartisan way, don't love that we have some bills that are works in process, but part of that is that we allow for those conversations to continue. And I think that's what will happen here. Again, thank you. Representative Zupkis.
Thank you, Madam Chair. And I do have to make a comment. And I am grateful for what you just said, as this is tough testimony. People come from bad places, and no one here knows what any of us went through, have gone through, been touched by. So I appreciate that. But to the comment that was said before, it is very insulting. And I am completely offended. I heard the same story when we talked about safe injection sites, about empathy. You don't know what empathy that we have. So I do not appreciate comments like that. They're
Representative
very
Zupkis, if
disrespectful.
I could just ask you to speak through the chair, that would be appreciated, and I understand the emotion.
Thank you. That's all I have to say. It's very disrespectful to anyone that votes no for some other reason. But I hope that never happens again. Thank you.
Thank you, Representative. Representative Claritas Deitria.
Thank you, Madam Chair, and through you to reiterate the comments of my colleagues to the right. I've never, in my 10 years being up in this building, have been disrespected about our integrity and what we want for the people of the state of Connecticut. I think everybody's goal is to get someone that is addicted into rehab and into a better place. How we go about it may be different. We may have different policies, we may have gone through different experiences, but I would hope that we get an apology from what was said to us here this morning. Thank you, Madam Chair.
Thank you. Seeing no other discussion on the item before us, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Representative Belton,
Belton votes yes.
Senator Marks, Senator McCrory, Senator Summers,
Summers votes no.
Representative Claritas Deitria,
Claritas Deitria votes no.
Representative Burgess Givallo, Representative Biggins,
Biggins votes yes.
Representative Carpino, Representative Dauphiné,
Dauphiné votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes no.
Senator Huckadell, Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy, Senator Kushner, Representative Morrow,
Mara votes no.
Representative Martinez, Representative Maureen Bello,
Representative Morin Bello votes yes.
Representative Parker,
Representative Paletta votes no.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Romano, Senator Slapp,
Senator Slapp votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Sir, I did not see you on screen.
Representative Steinberg votes yes.
Thank you. Representative Zupkis? Thank you, Madam Chair.
Thank you very much, Madam Administrator. Moving on to the next item on our agenda, which is item number 3. This is Senate Bill number 382, an act concerning edible food recovery. This is a JFS to the floor, LCO 2903. May I have a motion?
So moved.
Moved by Senator Anwar. Is there a second? Seconded by Representative Biggins. This bill would require the Departments of Consumer Protection and Public Health to jointly develop guidelines for the donation of surplus food by supermarkets, edible food, food that's unsold due to cosmetic appearance, nearing its expiration date, or damaged packaging that does not impact the safety of the food. It would also need to meet all food safety standards. The bill with the JFS language would narrow the scope to include supermarkets with 15,000 square feet of retail space or more. So we narrowed that down. Is there discussion on this item? Representative Clara DeStitria, to be followed by Representative Reddington Hughes.
Thank you, Madam Chair. Just to clarify, this is not a mandate. It's just, it's reporting to DPH and DCP.
This is, yes, it's a development of the guidelines and then reporting.
And do we currently know how much edible food is being discarded by Connecticut supermarkets?
I believe others do know. I will say that we had great testimony from the Food Association, and there have been efforts for, I believe, the past 6 years to continue to improve the donation of food. This is an effort to further that discussion, but I don't know the amounts right now.
Thank you. And currently, we know supermarkets are donating some of their food. What is the measurable change that we're looking to achieve from this bill?
I think the development of guidelines will help to be sure that all supermarkets of that size, now with the JFS language, 15,000 square feet of retail or above, will be clear, specific, and feel covered in what they're doing. So any, informal or formal efforts that are occurring would potentially be supplemented by those who now have a better sense of how they can safely do that and have it be clarified from the Department of Consumer Protection.
Okay, thank you. And I'm pretty confident that the bigger 15,000 square foot supermarkets do already donate a significant amount of food, and they also send it to the anaerobic digesters, which is very important in Connecticut. I'm just concerned that once this bill passes, it's just the gateway to then mandating supermarkets of any sizes now to donate food that they already do, and it's a mandate on our supermarkets to require them to do it when they're already doing it. I'll be a no today. Thank you, Madam Chair.
Thank you, Representative. Representative Reddington Hughes.
Thank you, Madam Chair. I wanted to know a little more on the reporting end, because I know a lot of these stores have inadequate staff to begin with. What kind of reports are we talking about?
That would be determined in part through the DCP and DPH guidelines that would be promulgated. So we don't have any specific language that's in the bill that says specifically what would be required to be reported.
And then this would be a requirement of any store that was over that 15,000 square feet, correct?
The reporting piece of it, yes.
Yes. Okay, thank you.
Thank you, Representative. Further comments or discussion? Seeing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vehy,
McCarthy-Vehy votes yes.
Representative Belton,
Belton votes yes.
Senator Marks, Senator McCrory, Senator Summers,
Summers votes no.
Representative Clara DeStitria,
Claire DeStitria votes no.
Representative Berger-Givallo, Representative Biggins,
Biggins votes yes.
Representative Carpino, Representative Dauphiné,
Dauphiné votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes no.
Senator Hockedal, Representative Cavros DeGraw,
Cavros DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy, Senator Kushner, Representative Morrow,
Mara votes no.
Representative Martinez, Representative Maureen Bello,
Representative Morin Bello votes yes.
Representative Parker, Representative Paletto, Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Romano, Senator Slapp,
Senator Slapp votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis,
No.
Thank you, Madam Chair.
Madam Administrator, Senator Marks votes yes.
Thank you.
Thank you, Madam Administrator. Next on our agenda is item number 4. This is House Bill number 5045. This is an act streamlining healthcare facility approvals. This is a JF to the floor. May I have a motion? Moved by Senator Rahman. Is there a second? Seconded by Representative Kitt. And I will preface my remarks by saying earlier in this session at some point, the good ranking member said that her hope was that this would be the year that we had the last of our certificate of need bills. I think she may have jinxed us, but with that, I will summarize what this bill does and just say very clearly before I do that this bill, as it is being sent out of committee, is not the bill that will pass the General Assembly. It needs significant discussion and work. As chairs and ranking members, we are in clear agreement that we will be discussing this bill extensively with the governor's office, with the Hospital Association, and with many others. So I will just outline the bill and then have discussion. This bill replaces the Office of Health Strategy Certificate of Need program with a 3-person panel, which includes the DPH, DSS commissioners, and our OPM secretary. It places the Certificate of Need unit within the Department of Public Health. It requires that new panel to meet at least quarterly. It lowers, in some cases, and expands in others the number of categories requiring CON approval. And it creates a separate process to oversee terminations. It swaps the current 8-physician threshold for review of group practices with a $10 million asset or revenue threshold. It requires review of transfers involving private equity. It explicitly expands review to include the acquisition of at least 20% of an entity's assets or operations by specific groups, including real estate investment trusts, which we call REITs, hedge funds, or private equity. It shortens the list of factors to consider in a CON determination. It allows the panel the ability to create an expedited CON pathway. It requires a hearing for all CON applications unless the applicant has waived that right in certain instances. And it makes additions to when a hospital transfer may be subject to the cost and market impact review process. And finally, it changes the daily penalties for certain CON violations from $1,000 to $5,000. Again, that is an outline of a 49-page bill that makes a number of sweeping changes, and I look forward to the discussion. Representative Claridis Tetria.
Thank you, Madam Chair. I won't go through my 20 or so questions that I have today because I know it truly is. It's a work in progress, though we know we hate those words, but this one truly is. So I just hope we can make some solid changes in this bill in its current form. So then maybe some of us at some point someday may be able to support it. Thank you, Madam Chair.
Thank you for that. I appreciate those comments, and I will say even this morning, having multiple conversations with folks from the current Office of Health Strategy and others about some specific ideas to address some of the questions and concerns that have come up here. For example, the small group practice issue is one of them, and I believe there are some ideas on the table that will specifically help us to address that gets at some of the concerns that we've expressed on a bipartisan basis at this circle and these tables. Senator Gordon.
Thank you, Madam Chair. And I too will hold just not on my 20 questions, but probably 20,000 questions that I have. I can reserve that for the Senate floor. But I do want to point out a few things. I appreciate that this is a work in progress. I think what's been proposed out by OHS, and I've read the governor's bill, I think is very ambitious given the realities of a short session and what's trying to be done. I think to make this bill workable, I think while one is moving OHS in part to DPH and in part to the Office of Policy and Management and whatever role the Attorney General's office might have, which is a big undertaking to do, we should focus just on the part we know needs to be dealt with, which is number one, dealing with what's happened when we let, not we, but when state government let private equity come in and run and buy some hospitals, and focus in not letting that ever happen again, but also focus in on the march over time that has occurred by state government off basically approvals of cutting needed services in parts of the state, including rural parts of the state, for women who need inpatient labor and delivery medical care. I think there are things that can be done to strengthen whenever a hospital system wants to cut back on services or eliminate a service, and open things up more for certain things when hospital systems want to expand services, expand the number of inpatient beds, or create a new service, depending upon what that may be. The whole aspect, and why I'm going to vote no today, even though I'm more than happy to continue to work on this bill with whoever wants to, and I appreciate the governor's office and OHS and others working on this bill with many people, myself included, is because it's going after the private practice groups. They don't create a problem. They've never created a problem. OHS wrongly testified that they were aware of problems, but couldn't actually specify what circumstances or actually what occasions they were in. And I think they're referring to one, and I understand it, but it's not what they said. And so to go after private practice in a CON, especially to broaden it, is going to hurt private practice groups, especially those we're wanting to keep in this state that provided needed services, especially those in family practice and primary care that might want to merge with another private group to help survive, given where we stand with unaffordability in Connecticut, including for private practice groups that are small, providing patient care. So I'm real concerned about that. I don't see any reason we should be doing it, and I have yet to see that fully explained. I think it goes directly against what was put in an application to the federal government to get huge amounts of money for the Rural Healthcare Transformation Grant. I know we just received 25 minutes before today's meeting a letter from OHS explaining that they feel that this bill as written doesn't conflict with the grant. I disagree, given what's been in the grant, and that's something one can work on. But I'm going to have to vote no, given a couple of the real egregious items in the bill, to flag it. But I'm going to continue to work as much as I can with you guys, with everybody, to see what we can do to make this bill better, manageable, and really get to the issues at hand instead of just throwing a broad fishing net into the waters and see what gets caught with regards to physician groups and small physician practices. So that's my reasoning for voting no on the bill as written, but I do appreciate your comments that this is a work in progress. We don't have much time, but it's still going to be a work in progress. Thank you.
Thank you very much, Senator Gordon. I appreciate your reference to the letter that each member of the committee did receive from OHS regarding that Rural Health Transformation Grant. I think that was an important clarification. Thank you for referencing whether we agree or disagree, but I had wanted to point that out as well. Also appreciate that you were saving your 20,000 questions and Rep. Claritas teacher, her 200. My hope is that we can answer many of those questions prior to getting to the floor. And I very much appreciate, again, on both sides of the aisle, the energy and effort and willingness to try and make progress on those significant issues that we've been talking about here and certainly have been a work in progress for a number of years at this committee. Senator Summers.
Thank you, Madam Chair. I will be very brief. I'm going to support this moving forward. This is a very important bill. It does absolutely need some work. Many of us have sat down with the governor's office, et cetera. I look forward to getting the language changed so that everybody can be on board. But I do think that this is really important and that we try to get something across the finish line in this session. So thank you, Madam Chair. I will be supporting it today, knowing that it's a work in process.
Thank you. I appreciate your partnership and your comments, Senator Summers. Next, Senator Almond.
Thank you so much, Madam Co-Chair. So I want to align some of my comments with that of Dr. Gordon or Senator Gordon. I think there are many issues in the bill in the current form at this point. The expansion of CON is concerning. This is something that has been a historical challenge that we've had in this building, but also the impact that it has had on the hospital systems. Also, the limited resources and aligning and placing those resources into medical practice is inefficient. That's been testified in on this bill, but others as well. Then the part where a healthcare system can leave a community without going through a process is concerning. We have seen the impact of that for women's health in parts of our state. That's an example, but there should be a process if the services are going to be reduced. So it's worthy of an in-depth conversation. Some of the other parts about moving it from Office of Health Strategies and moving that to the Department of Public Health, I have concerns about it, but I do not have as much concerns. That's the governor's right. He wants to make it more efficient, so that should be fine as long as nobody's losing their job and the efficiency and the work process does not necessarily change. But if this was a final version, my vote would be a no, but I know it's not, so it'll be a yes, with the understanding that we will have robust conversations and hopefully make it somewhat much better than where we are today. Back to you, Madam Chair.
Thank you very much, Senator Anwar, and I appreciate the reference to some of the work related and connected to this bill is going to be happening within the Appropriations Committee in terms of the move of the Office of Health Strategy, CON portion, over to the Department of Public Health. So I would just, recognize that these efforts are happening in tandem, and they're also happening in the context of some other bigger conversations related to the hospitals, the hospital tax, to federal funding. All of these pieces tie together, which is what helps to inform the conversation and debate that we are having on this particular bill. Seeing no other comments or questions, Madam Administrator, would you kindly call the roll?
Senator Anwar.
Senator Anwar votes yes.
Representative McCarthy-Vehy.
McCarthy-Vehy votes yes.
Representative Belton.
Representative Belton votes yes.
Senator Marks.
Senator Marks votes yes.
Senator McCrory. Senator Summers.
Summers votes yes.
Representative Clarice Detrier.
Clarice Detrier votes no.
Representative Berger Givallo. Representative Biggins.
Biggins votes yes.
Representative Carpino. Representative Dauphiné.
Rep. Dauphiné votes no.
Rep. D'Amico.
Representative D'Amico votes yes.
Representative Elliott. Representative Django.
Yes.
Representative Gilchrist. Senator Gordon.
Senator Gordon votes no.
Senator Hockedel. Representative Cavros DeGraw.
Cavros DeGraw votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Kennedy. Senator Kushner. Representative Mara.
Mara votes no.
Representative Martinez.
Representative Martinez votes yes.
Representative Morin Bello.
Representative Morin Bello votes yes.
Representative Parker. Representative Paletta.
Paletta votes no.
Senator Rahman.
Yes.
Representative Reddington Hughes.
Reddington Hughes votes no.
Representative Romano.
Romano votes no.
Senator Slapp. Representative Steinberg.
Representative Steinberg votes yes.
Representative Zupkis.
Did you call me, ma'am?
Yes, ma'am.
No, thank you.
Thank you. Thank you, Madam Chair.
Thank you very much, Madam Administrator. And we will be holding the votes open today until 3:30. So again, votes will be held open until 3:30 for those not able to be here. I didn't say earlier that legislators are in many different places, so we recognize that. With that, we will move on to item number 5 on our agenda. This is House Bill number 5241. This is an act establishing a triple bottom line justice demonstration pilot program. This is a JF to the floor. May I have a motion?
So moved.
Moved by Senator Anwar. Is there a second? Seconded by Representative Jenga. The bill before us creates a pilot program in Bridgeport to address the impact of the triple is health, environment, and economic challenges in the community. It focuses on brownfields to health fields and the use of ICD-10Z codes. These are diagnostic codes that document what we often refer to as the social determinants of health. The Department of Energy and Environmental Protection and the Department of Public Health are required to identify a list of relevant Z codes, along with a plan to have providers increase the use of these codes in their diagnostics. The DEEP and DPH are also must develop an education program for providers, patients, and hospital systems, and then report back to the committee. I will note that we had tremendous testimony from members of the community on this and their partners at Yale who are working together. I want to thank Representative Baker for his work on this bill, and also recognize that we will need to have additional conversation about this bill and pilot as well. I think those of us here in the Public Health Committee have talked extensively and are well aware of the impact of the social determinants of health on healthcare outcomes. I think this is a tremendous pilot opportunity, and we'll see how we can help this to move forward, but I anticipate there will be some additional changes to this bill as we meet with those stakeholders. Representative Clara DeStitria.
Thank you, Madam Chair. How will this pilot program be funded?
Thank you, Representative Clara DeStitria, and there's not a specific funding mechanism that is put forward in the bill. This would likely be something that would go through an appropriations discussion.
Okay, thank you. And so will this go through DPH? Is that what you had mentioned?
Yes, it would be the Department of Public Health and the Department of Energy and Environmental Protection jointly, and I think that's one of the challenging things about this bill. It's also the opportunity of this bill is that so many health issues cross our departments, so it's not just public health, it's not just environmental protection, it's actually economic development as well, but particularly in this bill, it would be DEEP and DPH working jointly.
Okay, thank you. And my follow-up to that is, do we know if these departments have sufficient staff to achieve what this pilot program wants to?
I think we've heard that they would need to have some additional resources in order to be able to do that, and that's part of the ongoing discussion to see how we might leverage some of those partnerships that exist to see if we can make that work.
Thank you, Madam Chair.
Thank you, Representative. Seeing and hearing no other discussion, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vahey,
McCarthy-Vahey votes yes.
Representative Belton,
Representative Belton votes yes.
Senator Marks,
Senator Marks votes yes.
Senator, I did not see you on screen, please.
Oh, hi. Senator Marks votes yes.
Thank you. Senator McCrory, Senator Summers,
Summers votes no.
Representative Clara DeStitria,
Clara DeStitria votes no.
Representative Berger-Giballo, Representative Biggins,
Biggins votes yes.
Representative Carpino, Representative Dauphiné,
Rep. Dauphiné votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes no.
Senator Hockedel, Representative Cavros DeGraw,
Cavros DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy, Senator Kushner, Representative Morrow,
Mara votes no.
Representative Martinez, Representative Morin Bello,
Representative Morin Bello votes yes.
Representative Parker, Representative Paletto,
Paletto, no.
Senator Rahman,
Yes.
Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Romano,
Romano votes no.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis.
No.
Thank you, Madam Chair.
Thank you very much, Madam Administrator. And again, a reminder, votes will be held open until 3:30 today. Next on the agenda, item number 6, this is House Bill number 5389, an act concerning a provider toolkit for the diagnosis and treatment of menopause, perimenopause, and postmenopause. This is a JFS to the floor. The LCO is 2858. May I have a motion? Moved by Senator Rahman. Is there a second? Second. Seconded by Representative Kitt. This bill will ask the Department of Public Health to develop a menopause toolkit. This will be in consultation and conjunction with the Yukon Health Disparities Institute, with providers and with those who have or are experiencing symptoms. The toolkit would include identification of symptoms, guidelines for identification and treatment, available insurance, and education models. The toolkit would be distributed by January 1st, 2028, and the S language added that providers and those who treat people with symptoms be added to the list of those consulted. And it also added evaluation based on provider feedback and then redistribution of that toolkit January 1st, 2029. Is there discussion on this item? And before I go to that, I do want to thank Representative Belton for her work partnering with the Yukon Health Disparities Institute and other providers on bringing this issue to the forefront. Is there discussion on the item? Representative Mara.
Thank you, Madam Chair. I do believe that this is an issue. I'm just curious, though, what is stopping the Department of Public Health from doing this now?
Thank you for the question. I don't think there's anything stopping them now. I think in part our department, as we've heard very clearly, continues to face extreme pressure on many different issues that we discuss here at this table. And this bill is a way to indicate that we are asking the department to prioritize this in assuring that that information is more widely available and disseminated. Information that is out there, but being able to put that together in one place, clearly communicated and from a trusted and source that has access for that wide distribution.
Okay, thank you for that. So my problem with this bill is we have the Department of Public Health, and they are looking at our needs across the state, and they have priorities. And we're coming in as a legislative body who vastly has a lot less experience understanding the issues across the state for the immediate needs. And we're asking them to prioritize something that may not be top of the list for them and what they're doing within the department. So I'm okay with us requesting the Department of Public Health look at this. I'm okay with saying we've had people that have come forward. Can you slot this into your priority? But to come through and say, hey, you've got to stop all your work on, maybe they have outreach with prostate cancer. Maybe they have outreach with some of the issues we have in our emergency sectors where we have cancer treatment and screening. So we're saying, oh no, put this on top of those. And I think that's where we need to stay in our lane and trust that the department has priorities. If we're finding that the department's priorities, or we're hearing that the department's priorities do not align with the state of Connecticut's needs, then maybe we need to come and reassess. But to come in and say that you need to stop and make this a priority instead, I think shows lack of trust in the current Department of Public Health. Thank you.
Thank you for those comments, Representative Mara. And as I mentioned earlier, I don't like to assume intent. I will speak for myself in saying I have no lack of trust in the incredible work that's being done by the department. And as I sometimes share in working in substance misuse prevention, much of the work is grant driven, and we know that about 80% of our department's funding comes from the federal government for specific work that is designated at the federal level. And I think that here at this circle, and through many debates, we do ask our department to prioritize different issues depending on what we've heard from constituents. So I understand certainly the valid concern of how to balance the limited resources that the department has with the many complex issues. That's what makes this committee so energizing and so informational and challenging at times, because we do juggle many demands. But the hope is that this is an opportunity for ongoing discussion, and as with the previous bill, discussion on how we can best leverage resources available elsewhere and partner with others to perhaps make this a little bit less of an impact on our department. Thank you for those comments. Seeing and hearing no other discussion, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vehy,
McCarthy-Vehy votes yes.
Representative Belton,
Representative Belton votes yes.
Senator Marks,
Senator Marks votes yes.
Senator McCrory, Senator Summers, Representative Clarice Detrier,
Clarice Detrier votes yes.
Representative Berger Javallo, Representative Biggins,
Representative Biggins votes yes.
Representative Carpino, Representative Dauphiné,
Dauphiné votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist, Senator Gordon, Senator Harkadel, Representative Cavers DeGraw, Representative
Cavros DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy, Senator Kushner, Representative Morrow,
Mara votes no.
Representative Martinez, Representative Maureen Bello,
Representative Morin Bello votes yes.
Representative Parker, Representative Paletto,
Paletta votes no.
Senator Rahman,
Yes.
Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Romano,
Romano votes no.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis.
No.
Thank you, Madam Chair.
Madam Chair, can I please vote no? This is Senator Summers.
Thank you, Senator.
Thank you very much, Madam Administrator. Moving on to item number 7 on our agenda. This is House Bill number 5399. This is an act concerning dentistry. This is a JFS to the floor, LCO 2926. May I have a motion?
So moved.
Moved by Senator Rahman and seconded by Senator Anwar. This bill will allow dentists to administer Botox or dermal fillers on patients' faces rather than the current allowance of cosmetic procedures on the mouth or jaw. This allows a dental assistant to take x-rays under the supervision of a dentist even when the dentist is not on site. It adds human trafficking and providing care for the IDD community as part of the mandatory topic list for continuing education. The S language changes, specifies that those cosmetic injections are only in the face. It clarifies the conditions for the dental assistant's administration of the x-rays. It adds that IDD language to the list of topics that could be included for the mandatory training and then make some technical changes. Is there a discussion on the item? Representative Reddington Hughes.
Thank you. Through the chair, I just wanted to know, when you're talking about the x-rays, I mean, when people go to a dental office right now, you would have to have the dentist there in order to read the x-ray. Is this saying that like a large dental facility could then perhaps have the dental assistants taking x-rays and have some other site where a dentist would be that would read all of those x-rays?
Thank you so much for that question. I appreciate it, because the request came to us actually more from those dentists who are single providers and solo practices. And what they are experiencing now is that they are able to read those x-rays remotely because of the technology today. So, for example, you've heard me say how much I love my dentist, and if I'll use him as an example, if he is away visiting his wonderful grandchildren and I have an issue with my teeth, I have the ability to go in. If we were to pass this bill, I could go into the office, have the x-ray taken, that x-ray could be read remotely. So he would still, as the dentist, he would be responsible, there would have to be permission, all of those steps would have to be taken. To answer your question, though, it's possible that could occur, that scenario could occur. I was simply sharing the why or the impetus behind the bill. But it is possible. Again, the dentist still must supervise and must order that x-ray.
My concern is that in a dental office, even if it's a larger dentistry division, as it is right now, the dentist would have to examine the patient after the x-rays were taken, and they would be able to ascertain, looking at their gums and other things that were involved, perhaps what was actually going on. This would then circumvent that. And I'm a little concerned that perhaps, the quality of care may be compromised. Thanks.
Thank you. I appreciate that. I wish I wasn't drawing on so much personal experience with this conversation and others around our teeth, with gratitude for all my dental care providers. But part of what we heard from the providers was, for example, if there was evidence on an x-ray of an issue that was occurring, there would then be an ability to, for example, prescribe antibiotics. So having been through a circumstance where I had to have a series of images, the physical exam was unable to demonstrate what was happening. I think that's the impetus. But to your point, there's nothing in the bill that then requires that someone come back to be treated. This though is geared towards those emergent circumstances where, as we all know, tooth pain will kind of compel you to get yourself back into that office with the care. But certainly that full scope of care and clinical judgment is what we expect and would want to continue with this bill or without. Further discussion. Representative Clara Destitria.
Thank you, Madam Chair. And in this bill, is there additional training that the dental assistant needs to take, or is this within what they're already qualified to do?
Thank you for that question. Yes, it is within what they are already qualified to do. No, there is no additional training, but they are already qualified to go through training to provide and administer those x-rays.
Thank you, Madam Chair.
Thank you. Representative D'Amico.
Thank you, Madam Chair. I had a couple of questions about a couple of the other sections of this bill that got changed with the substitute language. So one of them has to do with the continuing medical education. How did that change regarding intellectual and developmental disability as well as human trafficking? I noticed that there was a change, but if you could explain more specifically.
Thank you for the question. I appreciate that. And I will note that there may be additional conversations and further change. We learned through testimony from the Connecticut State Dental Association that the way that continuing education is determined is actually with the department and the Dental Commission. So we had some hesitation in our conversations and screening as to whether or not we wanted to make a move to make some of those changes based in statute versus allowing the process to go forward as it typically does. So I say we have S language that shifted the change in terms of, rather than immediately requiring that every dentist receive training to help support the IDD community, what we did in the S language was add that to the list. Currently, I believe it's 10 items that are part of that mandatory list. That's part of the broader continuing ed. But there may still be further discussions on that. And so I don't know if that fully answers your question.
No, it does. So it doesn't guarantee that that training is going to happen, but is that fair to say?
That's correct. This would mean that not every dentist, I think the original intent in the bill that we heard would mean that every dentist practicing would be required to receive that training so that they would be prepared to serve any member of the IDD community. The shift in the language meant that it is part of a list of mandatory training, so it would not then automatically require every dentist to receive that specific training. And again, like I said, there's to be continued on that.
No, I appreciate that, and I think that's a step in the right direction. So I don't have any problem with that. What I do have a problem with is the other major part of this bill having to do with injections, facial injections, cosmetic injections, and so forth. So I can't say that I read every single word of testimony, although I usually do, but I'm noticing that there is divergent testimony that has been submitted to the committee from medical society and plastic surgeons and dentists, some of whom favor this change and some of whom oppose this change. So when I see that, it makes me a little nervous. I am unclear as to whether the Department of Public Health did a scope of practice review on this issue. Would you be able to enlighten me on that?
Thank you for the question, Representative D'Amico. Yes, there was a process that the dentists went through. And scope, as you know, is always a lively conversation in this, both in the Department of Public Health and through the scope process, but here in this committee. And one of the reasons, again, I will speak for myself, we contemplated having this within the bill is that currently when there is treatment provided, the dentists are able to provide this as a treatment for a condition. And so this addition would be to allow them to also do those same kinds of injections for cosmetic purposes. Now, will all dentists take advantage of or want to do that? No. Again, I'll reference my own particular situation where I have spoken with some providers who have gone through the training process and have decided they don't want to do that, even as part of their treatment protocols. So this just allows them to do something for a different reason, but something that they're already able to do for therapeutic purposes.
So thank you. That's very helpful to have that information. Did the scope of practice review result in any conclusions, may I ask?
Representative D'Amico, I will confess that I have not more recently reviewed the scope report, but I know that there wasn't unanimous consent. That I do know, because of course we did hear testimony from different providers who had differing opinions on that.
So I appreciate that, 'cause that was my understanding as well, is that there was not consent as a result of that scope review. So again, I appreciate what you said, that this is already being done, but now this bill will allow it to be done not just in the course of treatment, but it would expand the ability to do this procedure. That However, it does not ameliorate my concerns based on some of the testimony that indicates that this is a very sensitive area of the body, and that there are many things that could potentially go wrong, and there was some testimony that indicated that the training that some practitioners receive is not sufficient to deal with the potential harm that could befall the patient. So it makes me really nervous when I read testimony like that. And if someone could make me feel better, I might be inclined to vote for this, but I'm going to have a problem otherwise. Thank you, Madam Chair.
Thank you, Representative. Senator Anwar.
Thank you, Madam Chair. Madam Chair, I too have heard some of the concerns from people in the community and the individuals who had testified. I think the way I look at this bill right now is it's an important move in the product, but it's not the final product at this time. So there may be some further conversations that we may have, but it is in sync with the number of conversations that we had with many stakeholders, but not all stakeholders are happy. We are trying to find that fine line where we can get the most people happy. So I can share that at least I'm going to vote yes, with the understanding that we'll continue some of the conversations to get more people on board. Back to you, Madam Co-Chair.
Thank you very much, Senator Anwar, excuse me. Seeing and hearing no further discussion on the item, Madam Administrator, would you kindly call the roll?
Senator Anwar.
Senator Anwar votes yes.
Representative McCarthy-Vahey.
McCarthy-Vahey votes yes.
Representative Belton.
Representative Belton votes yes.
Senator McCrory. Senator Summers.
I think you missed me, Madam Administrator.
Summers votes yes.
Thank you, Senator. Senator Marks, how would you like to vote?
I would like to vote yes.
Thank you. Representative Clara Destetria.
Clara Destetria votes yes.
Representative Berger-Givallo. Representative Biggins.
Biggins votes yes.
Representative Carpino. Representative Dauphiné.
Dauphiné votes yes.
Representative D'Amico.
D'Amico votes no.
Representative Elliott. Representative Jengo.
Yes.
Representative Gilchrist. Senator Gordon.
Senator Gordon votes yes.
Senator Harkadel. Representative Cavros DeGraw.
Cavros DeGraw votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Kennedy. Senator Kushner. Representative Morrow.
Mara votes yes.
Representative Martinez. Representative Maureen Bello.
Representative Lauren Bello votes yes.
Representative Parker. Representative Paletto.
Paletta votes yes.
Senator Rahman.
Yes.
Representative Reddington Hughes.
Yes.
Representative Romano.
Romano votes yes.
Senator Slapp. Representative Steinberg.
Representative Steinberg votes yes.
Representative Zupkis.
Yes.
Thank you, Madam Chair.
Thank you, Madam Administrator. Before we go on to the announcements of the time and date of the next meeting, I'm going to turn it over to my co-chair, Senator Anwar.
Thank you, Madam Co-Chair. Madam Co-Chair, through you, I just wanted to apologize to my colleagues for Senate Bill 365, that the comments I made. My intention was not to get you upset. I apologize for that. I know this is an emotional issue for me. Not a justification, but as an intensive care unit doctor, I have seen far more people die with overdose than anybody else, perhaps, that I know of personally, and that makes me a little emotional. And perhaps it's important to keep the emotions in check when we are having deliberation, and life and death and interaction with families makes it very difficult. So again, not a justification, but I wanted to thank you for your indulgence, and I'm so sorry. Thank you. Back to you.
Thank you so much, Senator Anwar. With that, we are going to go to the very last item on our agenda, which is the announcement of the time and date of the next meeting. And we will gather next in this room, please hoping that we don't have technical difficulties on Wednesday at 10:30 for our public hearing. We will gather again in this room on Friday at 10:30, and that will be for our final public hearing. So I look forward to seeing all of you, and I again will announce that votes will be held open until 3:30 on Zoom and in room 3000 in the public health area if you're coming in person. Thank you, everyone. We are in recess.
Yeah, that's what you said. Public hearing, yep, I have it right on here. Yep. And the environment is at 10. All of these are coinciding for me this year. It's like, you know, it's like I have no. Education and public health do often. But environment usually doesn't. Yeah. Yeah. I mean, yep. Outa.
I'm glad you said
Hi, Beverly. How are you?
Hi, Senator. How are you?
Good. I think I missed one item. I think it was agenda item 6.
Try to find out up and down. Thank you very much.
Senator Gordon? How would you like to vote on House Bill 5389?
I would like to vote yes.
Thank you, sir.
Thank you. Have a good rest of the day.
Thanks.
Beth,
Representative,
are you going to call us each by name or by bill?
I can do either way.
Doesn't matter to me.
Okay, Representative Paulette, I think you missed two votes.
I think it was just item number 3, and I'm a no on that, but that's it.
I'm just double checking for you, sir.
Okay, thank you.
So I didn't actually see your still
You're all set, thank you. Representative Carpino?
Yes.
Okay. Someone took my agenda. Can I give you just the bill numbers?
You can. I have my agenda. That'll be fine.
Okay, Senate Bill 364.
That is number. I thought I voted on that one, but that is a no if it was not recorded.
Yes, you did vote on that one.
Thank you.
Item number 2, 365.
I'd like to vote no.
Thank you. Item number 3, Senate Bill 382.
No, please.
Item number 4, House Bill 5045.
No.
Yes.
Item number 5, House Bill 5241.
No.
Item number 6, House Bill 5389.
I'd like to be recorded as a yes.
And item number 7, 5399.
No. Thanks, Bev. You're the best.
Thank you.
You hear, can hear.
Feedback, yeah, can you turn it up? Representative Romano?
Hi, I believe I missed the first 3.
Item number 1, Senate Bill 364.
Is it no?
Item number 2, Senate Bill 365.
That's also a no.
Item number 3, Senate Bill 382.
That's also a no.
Item number 4, House Bill 5045.
Yeah, I did vote on that one. That's a no as well.
Item number 5, House Bill 5241.
Do you not have all those?
Yeah, I have you as a no, thank you.
Yeah, no. Okay, yeah, so I believe it was just the first 3, but. Okay, do you have all of them now?
Yes, I have all of the votes
Okay,
now.
perfect.
Thank
Thank
you.
you. Have a great day.
Same to you.
Bye-bye.
Senator Kushner,
Hi there, how are you?
I'm doing well, thanks.
I could-
Item number 1, Senate Bill 364.
Yes.
Item number 2, Senate Bill 365.
Yes.
Item number 3, Senate Bill 382.
Yes.
Item number 4, House Bill 5045.
Yes.
Item number 5, House Bill 5241.
Yes.
Item number 6, House Bill 5389.
Yes.
And item number 7, House Bill 5399.
Yes.
Thank you.
Thank you.
You're all set, thanks. Hello, Michael. Thank you, sir.
Good meeting?
Huh?
Good meeting?
I like you too. Thanks, Mike. I wonder how many, Jesus, smell like people. Well dressed and smell dirty.
Hello.
Senator, House number 4 on the agenda, House Bill 5045.
Yes.
Item number 5, House Bill 5241.
Yes.
Item number 6, House Bill 5389.
Yes.
And item number 7, House Bill 5399.
Yes.
Thank you, sir.
Thanks very much. Have a great day. Thanks.
Diane, are you still logged in? Are you still logged in? And can you just go through things and take off the names of the people who voted, so it's easier for you, I didn't get a chance to do it.
Hello, can you hear me? Roger Guevara? The audio. You're not hearing? She's not hearing me. You want me to go back on? I don't know if she's distracted, but I'm not hearing. Yes. You just call iTunes, let them jump on your computer and see why your stuff not working. I'll get this in the meantime and see if it comes back. Okay. Yeah. I'm doing too. Thank you so much. I'm on a Zoom recording of votes. Our meeting has ended, but I'm not able to get my microphone. Persons can't hear me. 006. THLT 006. Yeah. This is a yes.
Hello.
Just a moment, Senator. I'll be with you shortly.
Okay,
Can you hear me, Senator?
I can.
Okay, just checking the microphone.
You're welcome.
Yeah, could you, hold on.
Senator Marks, how would you like to vote on item number 1?
Senator Marks votes yes.
Item number 2?
Senator Marks votes yes.
I have you for everything else.
Okay, much appreciated. Thanks.
Thank you, Senator.
Representative Gilchrist, can you hear me?
Yes, I can.
Okay, hi, good afternoon.
Hello.
You missed a few votes. All right, so,
I only voted once.
oh, okay. Okay, so for SB 365, how do you vote?
So I vote yes.
SB 382,
I vote yes.
HB 5045,
I vote yes.
HB 5241,
I vote yes.
how do you vote for House Bill 5389, Rep?
I vote yes.
House Bill 5399?
Yes.
Let's go 1, 2, 3, 4. I think I have you down for all of them.
Great.
All right, just let me double check. If there were problems. Yes. You voted for that one.
I think that's correct. I think that the most recent state to probably point to for you these actions is Illinois. So that would be a good state to look at.
Yep, just one minute. I'll be right out. Am I all set?
Yes, you're all set.
Okay, thank you. All right, have a good one.
You too.
Bye.
Hello.
Afternoon,
Good afternoon.
Senator Hackett. How are
Yes,
you?
I'm well, thank you. How are you?
Very well. Good to see you.
Thank you.
Let's make sure. All right, so we had 7 bills today. in the
Okay.
committee, And just gonna ask you how you vote on them. So SB 364, how do you vote, Senator?
Yes.
SB 365,
I vote yes, please.
SB 382, how do you vote, Senator?
I vote yes, please.
HB 5045,
I vote yes.
House Bill 5241,
I vote yes.
House Bill 5389,
I vote yes.
House Bill 5399.
I vote yes.
So, just double checking, Senator, just to make sure that you have voted on all the ones we did today. Please bear with me, Senator. I'm double checking something.
No worries.
Thank you. Senator,
Yes.
364.
Um,
How
let
do you
me
vote on that one?
let me just turn my camera back on. I vote yes.
Okay, thank you so very much
Thank you. Have a great day.
for your patience, and thank you so much for waiting, and we're glad to see you.
Thank you. Same here. Take care.
Have a
Bye-bye.
good day.
Like a 6-hour final meeting or something like that.
Hold on. You know what? I shouldn't tell you what that is. Representative Parker, good afternoon, sir.
Hey there, it's Rep
How
Parker.
are
I'm ready
you?
to vote whenever you folks are.
All right. All right. So we have some bills for you to vote on. All right. Okay. So for Bill 364, how do you vote, sir? Can you hear me? Representative Parker, can you hear me? Hello? Representative Parker, can you hear me?
I can hear you now.
Oh, okay. All right. So Senate Bill 364, how do you vote?
Yes.
Senate Bill 365,
Yes.
Senate Bill 382,
Yes.
House Bill 5045,
Yes.
House Bill 5241,
Yes.
House Bill 5389,
Yes.
House Bill 5399.
Yes.
Just let me double check, sir.
Thank you.
All right, thank you so much, sir. Have a good
Thank
day.
you. You too. Bye-bye.
Mhm.
Good girl.
Representative Elliott?
Hello.
Good afternoon, sir. How are you?
I'm doing phenomenal. How are you doing?
Okay, I'm well. All right, so we have some bills for you to vote on today.
Okay.
All right, we have Senate Bill 364. How do you vote on this, sir?
Yes.
Senate Bill 3665, the act establishing a bridge program for emergency treatment and recovery navigation for persons with an opioid use disorder. How do you vote on this one?
Yes.
Senate Bill 382, an act concerning edible food recovery. How do you vote on this, Senator?
Yes.
House Bill 5045. How do you vote on this one? This is the act streamlining healthcare facility approvals.
Yes.
House Bill 5241, an act establishing a triple bottom line justice demonstration pilot program. How do you vote on this, sir?
Yes.
House Bill 5389, an act concerning provide a toolkit for diagnosis and treatment of menopause, perimenopause, and postmenopause. How do you vote on this, sir?
Yes.
House Bill 5399, an act concerning dentistry. How do you vote on this, Senator?
Yes. Also, I'm a representative, but I do love you calling me senator. Don't stop. Don't stop.
Sounds like you're all set, sir.
Thank you so much.
All right, you have a wonderful day.
All right. Take care.
Bye. SB, just to make sure that this part was recorded, Representative Kennedy. All right, we have SB 364.
Kennedy votes yes.
SB 365.
Kennedy votes no.
SB 382.
Kennedy votes no.
HB 5045.
Kennedy votes no.
HB 5241.
Kennedy votes no.
HB 5389.
Kennedy votes yes.
HB 5399.
Kennedy votes yes.
Thank you so much, Representative
Thank
Kennedy.
you.
Have a good day.
You're welcome. Talk to you later.
Bye-bye.
Bye.
Hello.
Good afternoon, Rep.
I'm on the wrong one.
Oh, she's on. She voted already. No, she doesn't. Oh, she's on the wrong Zoom. Let me see. Corin, can you hear me?
Hey, hey, hey.
Hi, Senator. How are you?
I'm all right. I can't see you. I can't see you. Are you there?
I'm
Oh,
here.
there you go. What you doing, Diane? You work in public health now?
Yes, Senator.
When you started working over at public health?
For this year, this session, sir.
This session?
Yes.
So you left us?
It's not us, you're with us too. Over here. I'm still with Senate then.
You still with Senate Dems?
Yeah.
They just written you out?
The clerk, is she not?
Are you the clerk? Are you the clerk of the committee?
Yes, sir.
Yeah, she clerking on Beverly. She over there,
Yeah,
Beverly.
she's right here.
Bev, what Bev? Why ask Bev why she's stealing my people? Tell her to get her own people. Okay, what I got? How many bills do we have?
Yes, we have 7 bills. All right, let
Okay.
me read them to you and collect your vote. Senate Bill 364.
What's
An
that?
act concerning extreme weather protocol.
I'm a yes.
Vote.
Yes.
Senate Bill 365.
Yes.
That's act establishing a bridge program for emergency treatment and recovery navigating for
Yep.
persons with an opioid overdose. House Bill 5045, an act streamlining healthcare facilities approvals.
Yep.
HB 5241,
Yes.
act establishing triple bottom line justice demonstration pilot program.
Okay.
HB 5389, an act concerning a provider toolkit for the diagnosis and treatment of menopause, perimenopause, and postmenopause. How do you vote, Senator?
I ain't mess with no women. Yes. Ain't no women ain't getting on my ass about no menopause shit.
HB 5399, an act concerning dentistry.
I consider what?
Dentistry.
Okay.
Is that a yes, sir?
Yes.
Thank you. SB 382, an act concerning edible food recovery. How do you vote?
Yes.
Senator?
Yes. It ain't nothing controversial on this list. If it was, somebody y'all would tell me. I will hope.
Okay, all right. Thank you so much.
All right.
We're all caught up. Have
Thank
a
you.
wonderful afternoon. Thank you.
You too. Bye-bye.
Hi, Diane.
You missed a bill or two?
Yes, I missed the first three.
Okay, all right. Well, the second.
I was in screening.
Okay. So, SB, can you hear me?
Yes.
Okay, good. SB 364.
That's a yes from Cavros DeGraw.
Thank you. SB 365.
Also a yes from Cavros DeGraw.
SB 382.
Also a yes from Cavros DeGraw.
Let me just look at the others. Yes.
I think that was it.
Just checking. All right, I think you're all set.
Okay, thank you so much. Have a great day.
wonderful afternoon. Bye.
Bye-bye.
So on House Bill 5399, I'd like to change my vote from the affirmative to the negative. Excuse me. Change my vote from the negative to the affirmative. I would like to be a yes on 5399.
Okay, thank you, Representative D'Amico. Your vote has been placed.
There we go. Thank you very much.
Have a wonderful day.
You too. Thanks, Dan.
Somebody changed your mind.